Okay, we'll get started. Thank you for joining us for our latest media briefing on important healthcare issues in the news. I'm Zainab Abdurrahman, and I'm a clinical immunologist and allergist, mainly practicing in Mississauga, and I'm also the president of the Ontario Medical Association, which represents over 43,000 doctors. As doctors, we know our patients care deeply about their health, and there are valid reasons why someone might want to take their care into their own hands. It could be lack of access to physician care. We know we're in a healthcare crisis, inability to take time away from their work or from taking care of other members to take care of themselves. And there could also be fear or lack of trust in the medical profession based on the previous transgressions, especially for our equity deserving populations. When patients take health into their own hands and they actually implement some of these do it yourself treatments or remedies, unfortunately, there are often consequences. The treatments may not actually help alleviate the symptoms that they're looking for help on, or help with the disease or prevent a certain disease. Or worse, they can cause unnecessary harms or prolong symptoms or prolong them from actually getting the care they need. It makes sense that patients want to prevent disease and are eager to heal. However, we want to find ways that it's the best for them to navigate to do so. Because when they are doing it right now, they might be met with an overload of information from a range of sources for which credibility may be unknown, and it makes it harder to know what to do. Many symptoms or diseases do require specialist care, which can be unfamiliar or difficult to navigate for new patients. It's also interactions with a new physician can be overwhelming and can include a lot of new information as well. Doctors recognize complex circumstances that make do it yourself treatments appealing, but reassuring patients that experts are here to help, and we wish to share our expertise to help people heal. With that, I'd like to introduce some of our panelists today who are going to speak to the do it yourself trends that we're seeing. They're going to speak to it as per their specialty and give you some more details about how you can actually help get care in these settings. So, one by one, you'll start to see them. First, we have Dr. Valerie Primo. She is a bilingual psychiatrist practicing in North Bay, Ontario. She's held various leadership positions in mental health and addictions, both inpatient and outpatient care. And she currently serves as the medical director of the Department of Psychiatry and head of service for community mental health and addictions at North Bay Regional Health Center. We'll also have Dr. Alyse Goldberg. She is an endocrinologist in Toronto. Her research and clinical practice focus on the care of patients with polycystic ovarian syndrome, also managing hormone conditions in reproductive age women, hypothyroidism, as well as gestational endocrine and metabolic optimization. And we also have Dr. David D'Souza, who is an associate professor and radiation oncologist at Western University and London Health Sciences Centre. He leads image-based detections and treatments for several types of cancers. So we're going to hear from them, and this is a great mesh of different specialties because we know most Canadians are going to be affected by cancer or have family members who are affected by cancer. Endocrinology, in terms of going through the realm of different hormonal issues, which are constantly in the media, as well as mental health, which is a huge issue, as well as one in terms of people looking for guidance here. So with that, we're going to start with Dr. Valerie Primo, who's going to share about her experiences as a psychiatrist with patients who have been using or perhaps influenced by some of these do-it-yourself trends in psychiatry. Dr. Primo.
Merci, thank you. Perfect. I see my slide deck is up. So thank you, everybody. I'm hoping to give you a quick overview about the rising trend of self-diagnosis, specifically when it comes to mental health. When I think of anecdotes of patients, some of the things that my colleagues and I have seen more in recent years is patients coming to us and saying, my child has been diagnosed with ADHD or autism, and I see myself a lot in my child. Do I have this diagnosis? or I saw a video on TikTok and it sounds like I have all the criteria. That must mean that I have this disorder. So there's many reasons why people now reach out and look at self-diagnosis as a way to get answers. I've put some of the most common ones for mental health here. Part of it is access. So, and also the concern around barriers to mental health care, as well as financial barriers to access certain types of tests that may confirm diagnoses. In these slides, you will see there's multiple different clips of social media. So it's not hard to find different either media influencers or non-healthcare providers that will give you a video and encourage you to look at yourself and see if you meet criteria for certain disorders. Some of them are healthcare providers, some of them, or many of them are not. Next slide, please. Oh. Can we move to the next slide, please? My screen is frozen on my end, so I don't know if there's an issue with the slide deck. Hello? We'll just keep going. Oh, there we go. Sorry, I don't want to lose time. So in terms of also online testing, there's many tests that market themselves as being accurate to diagnose different disorders. These are the ones for ADHD. Some of them actually you pay for online to get a diagnosis, and some of them are free, and they tell you if they think you have a certain diagnosis. ADHD being one of the most common ones. Next slide, please. I wanted to talk a little bit about the potential risks of using these self-diagnostic tools or watching videos and diagnosing yourself based on the impression of someone providing information online. And the first concern, obviously, is misdiagnosis. And there's certain disorders that are high risk of misdiagnosis, specifically bipolar disorder, for example. In studies have been shown that it's not very accurate to do a self-diagnosis when it comes to that illness. When studies have looked at videos on social media, a lot of them are overly generalized, meaning they don't necessarily target a particular disorder, even though they say they do. They may portray inaccurately certain illnesses or provide misleading information. If you think you have an illness, obviously that will increase anxiety about having that illness, and you may not actually suffer from an illness, so that can be dangerous as well. You may be given unfiltered advice about how to manage the illness, which is not likely to be evidence-based, and you may reach for self-treatment. Some patients, for example, have reported to me trying a medication from, a friend, a family member, because they believe they suffered from the same illness and it's led to side effects. So that can be dangerous as well. The last piece I wanted to highlight is privacy issues. If you're giving your information on the internet without proper privacy security, that can be at risk as well. Next slide, please. There are, however, benefits of looking at videos or listening to people talk about their illness. One could be just enhancing your self-awareness that you may have an illness that needs further investigation. So it's not all negative. There's actually some studies that have shown that in terms of internalizing disorders, so by that I mean anxiety or depression, some of these disorders can actually be accurately self-diagnosed to some degree. Obviously, you still need confirmation by a health professional, but if you take a quiz about anxiety and depression, in the studies, they've shown to be more accurate than other types of mental illnesses if you do a self-diagnostic tool. And it may bring to light that you need to reach out to a mental health professional. So I always encourage, if patients come to my office, to let me know if they've done research. I think it's helpful to know what they've looked at, what they think might be going on, and why do they think that they might have that illness, right? What symptoms have they associated with it? It may encourage them to give you a better chronology or timeline of the symptoms so that you can understand better what they're suffering from. It also provides validation, and it provides a sense of community because they can meet or talk to other people who may have similar symptoms or illnesses. So I think it's important to take it into account if a patient brings it to your office and encourage them to talk to you about it and have the conversation. I never encourage somebody to self-diagnose, but I think it can be helpful in giving us additional information for us to confirm what they might be suffering from. I'll leave it there, and I'm happy to answer questions later. I'll pass it back to Dr. Abdurrahman. Thank you.
Thank you. Next, I'll pass it over to Dr. Alyse Goldberg to give us some comments from her field in terms of do-it-yourself trends and what she's hearing from patients. And I believe there's also a slide deck for her. Thank you, Dr. Goldberg.
Apparently my video is being disabled by the host. Is that, oh, start my video. Okay, nice. Thank you for having me. So I'm an endocrinologist, as was mentioned. So I see primarily patients with reproductive, endocrine, or hormonal issues while trying to get pregnant. I work in alongside fertility clinics as well as diabetes and pregnancy clinics at a hospital. So I'm sure that you're all very familiar with the plethora of hormone targeting discussion, particularly on social media, particularly in reproductive age women. And so I wanted to highlight that for us as clinicians to understand the trends, it's really essential in order to rebuild the trust with our patients and reframe their targeting and use of evidence-based care. But I also wanted to highlight what I personally, as someone who just talks about this all day with my patients, gets shown on social media. And I'm not even necessarily searching for it. So if you go to the next slide, this was some screenshots just from what my phone listens to me talk about and then promotes to me without me following these accounts. So what is your body telling you and what should you be doing from a lifestyle approach? Whether it's your bloating and your anxiety and your brain fog, which might be invisible signs of PCOS. Go to the next slide, please. You get targeted in terms of what therapeutic options your physician may be giving you, but then reasons to avoid some evidence-based treatment. And if you go to the next slide. And then other possibly non-medical or non-evidence-based therapies, whether it be tea, supplements. Here, this app in the third picture promises that people have lost 16 pounds in 1 week by following their program. You can add water to reduce your cortisol levels, or this last person uses tea to reduce her testosterone levels. So these all sound really wonderful, particularly in people who are having symptoms that may be linked or may not be linked to these conditions, but that it may show them and kind of fracture the relationship with their physician who have been withholding this type of recommendations from them. And then if you go to the next slide, I don't personally do a lot of menopause care, but the perimenopause age is, I find, quite big in the media right now, especially with all of the confusion and the changes in recommendations about hormone replacement therapy. And I know that personally, just discussing even non-menopause care with my patients, I get targeted with all sorts of different advertisements for either supplements or ways that my doctor has been withholding different treatment options for me. So I can only imagine what people who are not feeling their best, searching their symptoms specifically, will be given, and what additional recommendations that they'll seek out, which potentially could delay, in worst cases, harm themselves, and potentially be exploited from a investment perspective. If you go to my last slide, I apologize for the small font, but when I've been brainstorming with my colleagues who also see a lot of a similar population, these were some of the things that came out in our discussions, whether it's just the way that people are, or the advice on the internet is framed, really taking away from what medical care does and pretending that there is some sort of perfect root cause that needs to be addressed, or different dietary or supplement interventions, which might simplify the condition and are not necessarily generalizable to all patients. A lot of the recommendations are anecdotal, which, although can be reassuring when they work for other people, may not be transferable to a population at whole. So these are just some other things that we came up with. So testing approaches, which is not necessarily evidence-based and can potentially lead to searching for conditions that don't exist because of inappropriate testing assays that were recommended to the patients, or coaching programs, which although do give a potential degree of community, may be exploitative and misdirect people to pursue really restrictive measures. Yeah, so that's my section. So.
Thank you so much, Dr. Goldberg. Now I'm going to turn it over to Dr. D'Souza to talk about his experiences from a radiation oncologist perspective, seeing patients with cancer, another vulnerable population, and some of these do-it-yourself trends. Dr. D'Souza, the floor is yours.
Hello, good morning, and thank you for having me participate today. I have the privilege of looking after people who are diagnosed with cancer. They usually come to us with an established diagnosis of cancer that's usually made through another physician or another aspect in their journey of care. And I think most of us will agree that, as they often refer to it, the C word, or cancer, is scary. So when people hear this, I think often they feel very overwhelmed with their diagnosis, and they are looking for hope. So we do know that the Canadian Cancer Society statistics show about 63% of patients are alive at 5 years, and for a lot of patients with localized disease, it's very good outcomes. So there are some that patients unfortunately do not do well. So I think when a person's diagnosed with cancer, they're often wondering, where do they lie in this spectrum of outcomes, and often imagine the worst. So the first thing that they often do, if it's the patient or their family member, is they look for information. And in this day and age, looking at social media or going on the internet is the way to try to kind of find things. I always joke with my kids about how we had to go to the library when we had to do research or look anything up, but now it's just so easy to get online and try and get information that's there. And when you're looking for hope, I think some of the things that get portrayed, especially for cancer treatments that appeal to people, are things that are all natural, the ones that treatments come with very few or no unpleasant side effects, or they offer miraculous outcomes. And those are the kinds of things that people often will latch onto and be looking for. So there was a prior study done of looking at the most popular posts on social media between 2018 and 2019 with regards to cancer. And they found about a third of them had false, inaccurate, or misleading information. And you might say, well, what's the big deal, or what's the problem with it? Well, most of them are potentially harmful. So to give you a few examples from my practice over the last few years, there can be delays in seeking treatment for a cancer that is potentially curable. I had a young woman diagnosed with cervix cancer, and she came to us. She was not ready to accept conventional treatment, and decided she was going to pursue other remedies that she had heard about. And she came back 2 years later, unfortunately, with her disease having progressed and spread, in a lot of pain. And unfortunately, our ability to control and give her her cancer and give her a long-term a good outcome was severely compromised. There are sometimes just frankly dangerous things. I had a patient who had a tube going into their kidney because it was blocked. It's called a nephrostomy tube due to their cancer. And they actually tried to put the twine from a weed whacker in to get out the sludge that was in there. And they were asking about actually putting in a little bit of Lysol to clear it out. So fortunately, we stopped them from doing the Lysol part. Most recently, I've had a patient who's very well educated. She actually went and got a second opinion from Johns Hopkins, which is in Baltimore, yet she refused key parts of the treatment, and instead was going and driving 2 hours away from here for hyperthermia treatments, where they try to heat the body, and has been taking intravenous ivermectin, which we may have heard about as treatment for parasites that became popular during COVID. There's also patients who have done some really different things, like trying to inject or put things like cannabis oil on their tumor. I treat gynecologic cancers, and prostate as a lot of what I do. And I've sometimes asked a few questions to find out exactly how they get things in there. So the one aspect which I kind of view myself, we look to build a relationship with our patients who come to us. First, we don't know each other. It's like getting acquainted with a stranger. But what we look to do is build relationships and have trust. And once patients are comfortable, very often they will run things by or say, a family member offered this instead, or I was wondering about this. And rather than, coming back with a judgmental tone, I embrace the fact that they are communicating. I try to put it on a level of, do I understand it or not? Because as you can imagine, there are so many things out there. If they just say, what about treatment X as an alternative? I will first admit I don't know necessarily about their treatment, but I'm willing to try and look it up or get some further information. So the other thing I think, which is critical for cancer patients, when they come to us being told you need surgery, you need this type of radiation, you need this type of drug, it doesn't necessarily give them a sense of control. So the things that I try to encourage my patients are other aspects of their well-being. So as things like exercise levels, activity, the type of foods that they take in, without an emphasis on taking some type of supplement or something else that we don't have evidence to support. So it's really about engaging them in their own health, which I think is quite helpful. So I think it's important, and most of us in the medical field look to engage our patients, to not be hostile. I know when I started in practice many years ago, there were some physicians who would basically say, I don't want to hear it if it's anything else. And I don't think that's been the right approach that was done in the past. I think, most of us are on social media ourselves, and we do see what's out there. And being able to engage with our patients and kind of work through some of the things that they are coming up with is helpful. It often also relates to a fear or an underlying issue that they may have, come up with this idea, and it gives the good opportunity to address that. Thank you very much.
Thank you so much, Dr. D'Souza. We're going to actually move into our Q&A session now. I invite all of you to write your questions in the Q&A chat, the Q&A box. And then I'm going to turn it over to the OMA's Jordan Kerbel, who would moderate this portion of today's briefing. Jordan, over to you.
Thank you, Dr. Abdurrahman. Hello, everyone. My name is Jordan Kerbel. Just want to take this opportunity to say thank you so much for attending today's briefing, and to remind you that in order to ask a question, simply put your question in the Q&A chat box at the bottom of your screen. If you could please include your name and your media outlet, that would be wonderful. Again, just put it in the chat room, and we'll do our best to get to as many questions as we possibly can. We're going to start off with okay, sorry. So already, thank you. We have a question from Karen Lieberman. So Karen's asking, and I'll let you know who we're going to throw this to. If you can speak directly to patients, what would you tell them about the dangers of self-diagnosis or turning to Dr. Google? It's a fantastic question. Dr. Abdurrahman, why don't we throw that to you first, and then we can see if any of the other panelists would like to answer. The dangers of self-diagnosis.
Big dangers that we're talking about, I think each of our three speakers also mentioned this. One, sometimes some of these things are very general and they're not actually speaking to what you're specifically worried about. So you might be getting some suggestions that are not appropriate. There's a risk that you could also be taking on interventions that may be harmful to you because they're not necessary and they're actually causing other new issues. Or you could also have this delay where, there's a lot of different issues that when they do come up, this would also be very helpful to have taken care of early. This is what Dr. D'Souza was talking about in terms of some of the early cancer detection and addressing that early before waiting for further complications or spread. And this is the same, similar to many different issues where you can have consequent complications, whether that is even from something like waiting to diagnose and treat something like diabetes or other medical conditions. So it's important. And there are things that you can do that we may also recommend that are also in this realm of these are the supplements we do recommend in this condition. So you can also get that kind of guidance. So there's a lot of concerns when you choose not to and you actually choose to go in a different direction, but there's a lot of help that can be gotten if you are addressing it. And I'll also, perhaps, I don't know if anybody else wants to comment.
I think Dr. D'Souza would like to also answer this question. Dr. D'Souza?
Yeah, thank you. And to that question, I think it's a great one because we know people are going online. So it's as I'm sure my fellow panelists will say, most of the time, even when a patient's come to see us, they've tried to look up our profile online to kind of get a sense of our background and that. So the aspect of looking is not necessarily a problem. It's the interpretation of it. And I think the other aspect of what at stake is our patients and body or their health. It's a little bit different if I want to look up how to fix an appliance in my house or something else, and I try to Google and find a video of how somebody got something set up. I was trying to figure out an electric toothbrush, how to do something the other day, and I kept looking for a video to show how to do it. Well, the worst thing is I don't get my electric toothbrush to work, or there's some problem I caused to it. But the problem is if you go down the wrong path, you can cause harm. The other aspect, which I know has been mentioned, even in our field of oncology, things are changing so quickly. Information that was relevant or the way we would treat things even 2 years ago in some areas changes. So the problem is sometimes some of these videos and other information may be dated. It could look like it's from 2023. It's not that old, but it may not be the correct thing. Even the way we profile a lot of cancers these days is based on biomarkers, additional information, which the patient may not even be aware of. So the problem which I try to avoid is the perception that we somehow know more or we feel there's an air of superiority. It's not that. It's just that we can understand some more details. And I always look to explain that to the patient at a level that they understand.
Thank you, Doctor. The next question is from Liz Payne, Elizabeth Payne with the Ottawa Citizen. Can you quantify how big a trend this is and how quickly is this growing? I'm going to throw this one over to Dr. Primo.
Thank you. I don't have obviously specific research numbers, but I would say if I speak to my colleague and what I've seen from my experience, like it's probably at least a patient out of 3 that will bring up some form of self-diagnosis or self-management. So examples of like, oh, I've been diagnosed with HHG. Well, not yet, but it's just because somebody hasn't made the diagnosis yet, but I know I have it, or something to that respect. And that will happen at least in 1/3 of the patient encounters I have. And I think part of that, if I look over the past 12 years that I've practiced, is the rise of technology advances, right? I think it was Dr. Goldberg that was mentioning her phone is listening to her and showing her certain content related to her work, right? So our phones now are intelligent. They listen to what, and they look at our trends. And if we talk about something that we're concerned about, they will show us videos that relate to that. So the answers seem more immediate and accessible, and people want that. People are looking for answers, and they get that validation from that access on social media. So I think that is why it has been rising so quickly, is availability of that kind of consumerism type of access, right? We're just looking for quick answers, and the internet is willing to try to provide those answers, if that makes sense.
Dr. Abdurrahman?
Yeah, to give you some quantification, this has been increasing, and the Canadian Medical Association has actually been doing an annual survey where they're looking at health and media annual tracking, and the numbers are going up each year. The 2025 survey had shown 62% of Canadians have encountered health information that they later found to be false or misleading, and this was increased. So people are also realizing that, but also what was a concerning statistic was 23% reported having a negative health reaction following online health advice. So we are seeing this. And we also, when you break it down by generations, we're also seeing a higher uptake, especially in some of our very young populations who are still in their teens and early 20s, who are looking more at social media, and in terms of how they quantify how reliable or credible a source is versus other generations. So this is something that is very important that we need to continue to keep on top of.
Thank you, Dr. Abdurrahman. I'm going to throw now to Janice Golding. Janice Golding asks, that there has been a lot of distrust arose during COVID regarding vaccines and other recommendations that were ever changing, and that has done a lot to erode public trust. How do you suggest how do you suggest repairing that trust? Dr. Abdurrahman, I'll start with you, and then Dr. Goldberg, I'll throw it to you after that.
Thank you. Especially talking about COVID vaccines, particularly, sits for me because I did a lot of work in this realm, just even to talk about building trust to take the COVID vaccines initially, especially looking at certain populations, thinking especially about Black populations with different experiments, Tuskegee, et cetera. What happened with COVID, though, is this was, as we always say, unprecedented times. We also had a lot of changes, and I think a lot of people are used to having new recommendations come out, and then that's the status quo for quite a while. But we were actually in a changing model, and so people actually saw what it's like for us to pivot and change based on what was happening. And so with kind of movement, some of this will continue to happen in terms of us changing recommendations based on further research. And so I think what we have to do is be able to convey that we do change strategies when we get new information. It's like when Dr. D'Souza said some of the cancers, how we treated them earlier with new treatments, new modalities, we are changing. So within 2 years, how we treat certain cancers can really critically change. And you want a medical system that is dynamic and responding to the new information to get you the best health. So I think part of it is bringing everyone together to understand that technology is changing, research is leading to change, and we're going to continue to pivot to provide the best care. And you don't want a system that's stagnant when it comes to your health. This is, in response to providing better health. Although sometimes it seemed very fast during COVID and with the COVID vaccines, but we continue to do this with all of our treatments. You may just not get quite this short period where a lot of things change quite fast, but we do have changes. And as an allergist, I can speak to that even with how we talk about preventing food allergy. Initially, we thought maybe avoiding foods when children were very little, but we've actually seen the research and that's really made us pivot. And it's the exact opposite. Now it's very important to introduce foods very early when they're under 11 months of age. It's a total pivot. So that's also but that's from research as well. So we do have to pivot when we're seeing this. And this is about talking and explaining why. And I think that's going to be the key part of building the trust again.
Dr. Goldberg?
Got it. There we are. So again, not specific towards the vaccine world, but in my patient population, we have a lot of discussions about both less evidence-based and less research therapeutics, like in the supplement world, or very evidence-based and very experienced medications, such as the birth control pill or metformin, which will definitely get a lot of different opinions online based on people's personal experiences and their own belief system. So I find success in really having like open conversations and really educating in both from a pathophysiology perspective to try to explain what the theory is or what has been shown in the research about why these medications are often used, why certain things are considered first line, how certain medications can really improve or may not be the right thing for different people, and really emphasizing that we're all really in this together to try to help our patients feel better, prevent complications, and in order to like have them I guess, getting through with whatever condition they have in the most successful way. So with that in mind, there has to be lots of open conversations because there's lots of evolving both research and evolving therapeutics in all fields.
Thank you, Doctor. Another question from Karen Lieberman. Why is this a bigger issue now than in previous years? Is it connected to a lack of family physicians in Ontario? I'll throw this one over to Dr. D'Souza to start, please.
We do have difficulty, of course, in our province with patients accessing primary care and seeing a family physician. I can give you my opinion because, again, I can't give you evidence to prove that it is the case. But my practical experience, often when I'm following a patient with cancer, okay, they've got pain, and I want to know, I'm the specialist seeing them once in a few months. Do I prescribe the pain medication and they live an hour and a half away, or do I ask if their primary care physician can do it? And they say, well, I see on the record they don't have a primary care physician. So, sometimes aspects like that, you can see why, if they had pain before they came to see me, why they might be looking to see, well, what can I do to just help myself? So that's just a practical example of what I see. The other area that would happen a lot more before is when people had a good relationship and had access to their primary care physician. If they had something like, I got to decide whether I'm going to have my prostate removed surgically or to get some type of radiation modality, they say, I'm going to go talk to my family doctor. They've been my family doctor for the last 25 years. My kids were born and raised, for the pediatric care through them. So I'm going to go back and have a chat with them and see what they tell me. And generally that's not the case now. So those are just two practical examples. Some of my colleagues may have some insight too.
I'll just chime in for a moment. I would definitely agree that with what Dr. D'Souza said, and the fact that not having access to a family doctor does play a role here. The crux of what Dr. D'Souza said, and I think everyone would agree here, is that it's about being able to ask these questions is about trust. And one of the places where you have a lot of trust because you've had a long relationship is your family doctor. And that's someone that you can feel comfortable to bounce some of these ideas by. And so when you don't have that, you're often feeling like you're going to all these other sources and you're not able to necessarily check the credibility for these resources. So it is playing a big role. And that's why we're also very much advocating in terms of every Ontarian having access to a family doctor, because these types of conversations do need to happen, and it's got to be in a trusting situation. And that's one of the places where you have a really great trusted resource for your health.
Thank you, Dr. Abdurrahman. The next question is from Nicole Ireland. Nicole Ireland, the Canadian Press. Knowing that patients are going to look online and to social media, how do you advise them to distinguish between reputable information and mis or disinformation? And for this one, I'll throw it over to Dr. Primo.
Thank you. I would say that it's probably difficult for members of the public to distinguish what would be reputable versus not. So I would always recommend seeking help from your family physician or a professional. But in general, like when I was talking about emerging research in mental health, for example, they showed that there was more accuracy in videos that were provided by health care providers online versus non-healthcare providers. So if you can confirm that you're hearing information from a healthcare providers, whether it's a presentation or a video, then there may be more accuracy to the information. Obviously, official sources, like anything coming out of the OMA, would be a good source to follow. So looking for a medical association releasing information as well would be obviously more trustworthy than something that you find on a social media platform. But I think in general, it's really hard in a sea of information to tell the difference. And I always recommend is bring what you found to your primary care provider or a professional if you're able to make sure that you can tell what is appropriate and what isn't.
Thank you, Doctor. We've had kind of a follow-up question, so I'm going to leave this with Dr. Primo from Joanna Fredich at the Hamilton Spectator. So when people do turn to the internet, where would you recommend they start? Like, are there actual reliable sources they can turn to, and what should they absolutely avoid? So we can start with Dr. Primo, and then anyone else that wants to answer, that would be wonderful.
I can answer from a mental health standpoint if that's helpful. There are definitely guides, for example, like major hospitals, mental health hospital like CAMH, for example, in Toronto, will provide a lot of good patient information on their website. So if I were to start somewhere, I would go to the CMHA website, the Canadian Mental Health Association, or one of these larger research hospitals, because they often provide a lot of very lay-friendly information. And then they give you extra steps, right? So if you notice that you may have some those things, this is what you should do next. And that information obviously is going to be safer and more reliable than anything you would find on a social media platform. So that would that's where I would recommend starting. And CMHA also has drop-ins, so you could always go to your closest CMHA as well to meet with a clinician to discuss some of the research that you're doing, and they will give you some additional information as well. So that would be kind of for mental health where I would recommend starting.
Thank you, Doctor. Dr. Abdurrahman, can I throw that to you as well, please?
Sure. Definitely, like Dr. Primo said, there's a lot of great health organizations that can be issue specific, disease specific, or kind of cover a variety so that you can look at the medical associations, OMA, CMA, in terms of larger kind of health, social health issues. But then you might also be looking at specifically to the actual disease. You can go to Cancer Care Ontario. There's a lot of different ones, Food Allergy Canada. There's a lot of different ones depending what the issue is. What I would also want to say is that when you see perhaps an ad or something on social media that says, this has been hiding from you, this is kind of never before seen, if there's any kind of wording like that, do go to the kind of associate medical association that would deal with that. If it's a whole new cancer treatment and they say this is being, suggested by all cancer associations, go to Cancer Care Ontario, go to check all these different websites and check for them to be actually putting that information, if they are actually backing it. So there's also an important fact of cross-checking by going directly to the organization and seeing if it's there, because there is a lot of AI-generated programming out there as well that sometimes pulls in different names. So it's also important to go and check the source, because most organizations aren't backing any particular medication or anything like that, but will give you information about generally about where to get credible information.
Thank you, Dr. Abdurrahman. The next question is from Helen Bagshaw, and this is for Dr. Goldberg. Is Dr. Goldberg seeing most of the misinformation? Is it related to polycystic ovary syndrome, or are there other fertility issues that people are self-treating for?
Oh, there's all sorts of things. You're getting my bias because that's the majority of my practice right now. And I think that young reproductive age women are spending a lot of time on social media. So I will get to hear what the current trends are and what different recommendations are there. But yes, and there's all sorts of fertility influencers, and then there's male reproductive care. So it's not obviously not just for women. But I think in a lot of the endocrine conditions, they are very heterogeneous. They present differently for each individual. And sometimes they're made up of a lot of non-specific symptoms. So if people aren't feeling well, they will be able to look into their symptoms and they will get a whole array of conditions that potentially will make these patients feel very validated and heard. And then when they're discussed, if it's not necessarily the correct syndrome that's going on, it can become very challenging to kind of overcome that.
Thank you, Doctor. The next question is going to be for both Dr. Primo and Dr. D'Souza. So we'll start with Dr. Primo. What do you say to patients when they walk into your practice and they have already self-diagnosed themselves or decided what treatments they need? How do you deal with those patients? Dr. Primo, then Dr. D'Souza, please.
Thank you. I think one of the biggest things is patients want to feel that they have a say in the decisions that you make with them in the appointment. So when they come with me with already some opinion about what they might be suffering from or their treatment, first of all, is I take the information, right? So I think listening to what they found and trying to understand why they came to that conclusion and what have they tried and how they obtained the treatment, whether it's a supplement or a medication. And then once I have that information and done my diagnostic interview, if there is a discrepancy, let's say what they think they have is not what I think they have, then we have an open discussions about it. And I often bring information that I have in my office. So it really helps to actually open your book and show to the patient, this is why I think you have this illness. These are the criteria that I believe you've told me today. And these are the ones that I don't think fit with you. And that's what you thought you had. And most of them will realize that it actually makes sense where we're leaning towards. Often they just had misinformation and thought that they fit in a category. A big example of that is bipolar disorder versus borderline personality disorder. There's a lot of overlap in symptom between those two, and patients often misdiagnose themselves with one or the latter. And it just helps to actually explain to them why they fit in one category over another. So I think involving them in that kind of decision making and that partnership is really important in building that trust.
Thank you, Dr. Primo. Dr. D'Souza.
Yeah, so for cancer, it's usually there's a confirmed diagnosis. So it's usually patients mapping out their own treatment. So one aspect, even if they were to receive care, any patient receiving care, to have informed consent means they understand what their options are and kind of what the outcomes or likely outcomes are from those. So if they choose a different treatment of their own choosing, I will first make sure they understand the disease they have and the likely timelines that it may progress. And if it's going to change to a setting where they're very unlikely to be cured or they will not be cured. So I think that's an important aspect because cancer is uncontrolled cellular growth. Some stay local, some may spread, and they do them in different time frames. But to understand what they are looking at if their treatment isn't effective. I do let them know what options are available that I would consider as appropriate for them. And if they aren't going to have treatment with me, I generally will not be involved in ongoing monitoring because there really probably isn't much point. But I will leave the door open and give them the avenue if they need to get back to see me, or if they change their mind, they can do that at any point.
Thank you, Doctor. I'm going to throw the next one to Dr. Abdurrahman. Dr. Abdurrahman, this is from Nicole Ireland at Canadian Press. When you advise people to bring information they found online to a primary care provider, who should they go to if they don't have a dedicated family doctor? Should they go to a walk-in clinic? Who would be the best person to speak with?
That's a great question. And it can also, it may not be one simple answer because it might depend what it is. For example, I think Dr. Primo kind of alluded to some of this earlier, that if it's more mental health, we do have the mental health associations that are kind of based in communities that you're able to actually access and talk to a clinician, and that might be one of the ways. If it is something for a treatment, you can access a doctor in a walk-in clinic to have that discussion and to talk to them there as well. And sometimes when it comes to specific things too, for example, when we were talking about a lot of times with even, measles right now, because that's still top of mind, and talking about that when you don't have access, we did have, obviously with the government, they have access for patients to be able to contact through there to get linked in to get vaccines or to talk about the vaccines as well. So definitely there's a lot of avenues to also still reach doctors to talk about this if you don't have a regular doctor. So whichever of the avenues kind of works best for you, please do kind of utilize it. As long as something that you can easily access and that you know will be reliable for yourself and based on your community as well. So I think that utilizing any of those would be very helpful.
Thank you, Dr. Abdurrahman. Follow-up to that question, this one I'm going to throw over to Dr. Primo. Do you see the internet and social media as a valuable place to turn for people to get peer support?
Thank you. I would say that in general, yes, although obviously it depends on the composition of the group and who would be running any type of peer support. But for example, I'll give an anecdote from my practice. I do a lot of addiction psychiatry, and one of my patients mentioned that one of the strengths that they found was there was a Reddit group where they were fostering abstinence and they were getting together and talking about not drinking. And that was really helpful for that particular individual. They felt not shamed, they felt accepted. There was no judgment, and it was a good cohesive group. So in that case, that was a very positive experience. Now, I've also had on the flip side some patients that have told me that they've been stigmatized or shamed online for disclosing. So I think obviously there's caution to peer support online, especially if it's not regulated. What I would encourage is using online tools to access peer support that is regulated to some degree. By that, I mean if there is a professional moderating, which there's different groups that do that. For example, in addiction, there are a peer support group where there is a moderator, but it is all peers otherwise that start the discussion. But it's just to make sure that the environment is not judgmental. So that would be a way to ensure that it's safe, but also very helpful. So maybe just being cautious about which type of peer support you seek online, because there's all kinds of stuff, right?
Thank you, Doctor. We've had a question from Mike Pearson at Metroland Media. Speaking of DIY treatments, can you speak to the migraine TikTok and social media trend, which people believe that McDonald's fries and a Coke can relieve migraine symptoms. If not that one in particular, can we just talk about the trend of TikTok videos and having more younger people watching TikTok and turning to that for, I guess, their potential treatments? So, Dr. Primo, I can start with you because I noticed you nodding, and then I can throw it to whomever else. No, I'll throw it over to Dr. Abdurrahman.
I don't know anything about it. Just think if it was true, that would be a great reason to eat this amazing fast food. That's all.
Dr. Abdurrahman, the prevalence of TikTok videos for any number of these ailments.
Yeah, there's always like that need to looking for some solutions, right? That's kind of why we're here. And so we do see a rise in a lot of different TikTok videos. And what I would say is that there are a lot of different ways to address a lot of different medical issues that may not require specifically medications. I'll speak a little bit to migraines, not fully to just the TikTok video, but for example, sometimes people come to me and they say, I read that all these foods affect migraines. This must be an allergy, and they come to talk to me. And one of the things I do talk a lot about in my office is that, okay, let's talk about the root problem. You're worried about how foods are affecting your body and how they're affecting your migraines. Foods do affect bodies in a lot of different ways. And we know that when people have migraines, we can have cheeses trigger their migraines. And for some people, caffeine can be a trigger. And for some people, in some of the treatments for migraines, sometimes caffeine is used. So it's also a trigger. It's also can be part of the solution for some people. So I can understand why they're perhaps talking about fries and a Coke in that kind of context. But the thing is, you want to actually have the conversation. So whoever is treating your migraines, if you're talking to your family doctor, you're talking to your headache specialist, your neurologist, say, can we talk about how foods play a role here and which foods maybe I should avoid or which foods can be helpful if I am having a migraine? Because there are lots, and I think each of us would talk about them in a lot of different issues in terms of how foods can be helpful. But sometimes if you're in a crisis mode, some of the foods that you eat all the time could bother you. So, these are big, important things to think about. And migraine is a big one because migraines really, it's a balance in terms of your neurotransmitters. And a lot of different foods can play a role in that. Chocolate can play issues with migraines, caffeine, as well as strong cheeses. They're not an allergy, but they can definitely play a role here. So I think it's worth having that discussion and talking with your specialist to see which ones are playing a role for you and what to do, because each person is different. So it's not an easy one to say everyone take this diet with a headache, because that meal that was described is also a trigger for many people because it can contain things like cheese and caffeine and salt, so which can play a role there too. So this is where it needs to be individualized to you.
Thank you, Dr. Abdurrahman. To all the journalists online, we're going to do our best to get to the questions in the next 5 minutes. So I'm going to ask the participants if we can go fast. Dr. Primo, as mentioned in this presentation, ADHD seems to be a particular focus of social media self-diagnosis right now. Why do you think this is happening with ADHD, and what specific messages do you want to get around the self-diagnosis of ADHD?
I will try to be brief. But if I ask everybody online today, have you ever been distracted or had trouble with organization or answering all your emails? I think most people are going to say yes. And this is why I think there is a rising trend to self-diagnose with it, is because we recognize ourselves in the videos that are played about ADHD, because in general, society is struggling with inattentions. And that would be a whole talk aside. So we don't have time for that today, although I'm happy to do that later if the OMA wants. But essentially, ADHD is a neurodevelopmental illness. And I think people forget that. So you technically have to have it in childhood before a certain age. And that is not portrayed in social media. So when I talk to patients, I make sure to confirm the childhood history. Whether it was documented in school or not, we still need to make sure that there was a history, talk to the parents. And that's the piece that's missing in the portrayals online. And that's why people get confused, because we have inattention in general as a society right now. So it's just something that resonates a lot with us. And I think that's why.
The final question, thank you, Dr. Primo. Final question, I'm going to open it up to the floor if we can give quick answers, but to all the panelists, why do you feel that now is the important time to warn people about DIY healthcare? Why now? Dr. Primo, you've got your mic open. Why don't we start with you?
And sorry, can you just repeat the question really quickly?
Why now?
Oh.
Why is it so important that right
Yeah.
now we forewarn people about the dangers of DIY?
Yeah. Because it's happening more right now. And I foresee it continuing to happen more and more, especially with AI technology getting more and more available and more sophisticated. I have patients now that talk to ChatGPT to get advice and have a conversation. So I foresee that we will continue having this issue. And if we don't address it now and help people navigate this, they will struggle. We have challenges with access that's not likely to go away, right? It's a national problem. So we need to address how patients navigate these issues on the day-to-day. So I just think it's very relevant and will continue to be an issue going forward.
Dr. D'Souza, can I throw that over to you as well? Same question.
Yeah, I think it's a problem that's been identified before, but we it's been more established. I think particularly after COVID, the pandemic, with people more and more going online. Pretty much everybody, including my patients who are in their 80s, have a smartphone and look at these things. So I think it's important that we address this now. The last anecdote I'll give is a patient came to me asking if he should wait to have his cancer that was diagnosed treated in a few years, because he believes that AI will customize cancer treatments for patients. And I had to convince him why he should have treatment now.
Thank you, Dr. D'Souza. Dr. Goldberg.
I think two things come to mind. So firstly is the AI aspect. And I know that a colleague of mine from Europe was doing a study on misinformations in reproductive endocrine and AI, and giving out surveys to different physicians and how they would rate the answers that were provided. And all of them had partial truths and partial misinformation. And that can lead to more confusion, because there's a little bit of truths in a lot of what the AI is saying. And the second, I think, is with so many people building online businesses and the proprietary aspect of social media. So we really have to be mindful about who is trying to make money off of us, and use our symptoms and our medical experiences in order to self-promote themselves.
Thank you, Dr. Goldberg. Dr. Abdurrahman.
Thank you. I agree with all the points that are brought up. The other issue that we have to remember is it's increasing, and it is going to younger and younger generations. So we're having lots of our teenagers and preteens also looking at this and trying some of these for what they perceive may be issues affecting them. So we want to ensure that we are talking about this, we are addressing this, because it is an important issue, and we're going to have more and more people seeing this because social media is so pervasive in our day-to-day lives. So we want to come and address and talk about this and talk about how to get credible information, because we know misinformation and disinformation is something that as a society we are managing, and healthcare is not immune to this. With that, Jordan, did you want to?
I was going to say thank you, Dr. Abdurrahman. To the reporters, if we didn't get to your questions, in the media advisory you were sent was Julia's email address, the OMA Media. Please just send the questions to you, and we'll do our best to get them answered. Dr. Abdurrahman, back to you.
I just want to say thank you to everyone for attending today's briefing and for all your thoughtful questions. If we didn't catch any questions, media team will follow up with you. If you want, you can also email media@oma.org with requests for interviews or information. I'm sure from hearing from these three great doctors, you might actually want to have further discussions with them, especially pertinent to their specialties, as well as perhaps in the communities where they are. And a recording of this session will be available on the OMA's YouTube channel immediately following this briefing as well. Thank you again to our three physicians. I really appreciated hearing all your different thoughts and hearing about the importance, especially in your different fields, and sharing the stories, because that's really the importance of why we're here. It's because of our patients and what they're sharing with us, and we want to make sure that we're providing them with the best care. So once again, thank you so much.